This is The Week on WURD, a podcast featuring a roundup of the most interesting, informative, and entertaining interviews from WURD Radio. You can listen to WURD Radio anywhere, anytime on WURDradio.com and the WURD Radio app. Give us a play and download it today. In this episode, Dr. Kayla Elliott, Director of Workforce Policy at the Joint Center for Political and Economic Studies, joined Evening Words with Dr. James Peterson to break down the Joint Center's work as America's Black think tank. And Minority Leader Kendra Brooks, Philadelphia City Councilmember At-Large, joined ecoWURD magazine with P.O.C. to address the rise in ICE activities across city neighborhoods and the heightened fear facing immigrant families. But first, Dr. Terence Keel, UCLA Professor of Human Biology and Society and author of The Coroner's Silence, Death Records and the Hidden Victims of Police Violence, joined Wake Up With WURD with Solomon Jones to examine the country's broken system for tracking deaths in police custody.
Joining us now is Terence Keel. He is Professor of Human Biology and Society at UCLA. He's also the author of the new book, The Coroner's Silence, Death Records, and the Hidden Victims of Police Violence. Terence Keel, welcome to the show.
Good day, Brother Solomon. Great to be here. Yeah. I'm happy to have this conversation with you.
Yeah, great to have you. So, police, of course, are sworn to protect and serve. They take an oath to do that. And there are people that we know about who are killed by police every year. But then there are people that we don't know about. Why is there this hidden aspect of people who die at the hands of police? How do they hide that?
Solomon, part of what you're talking about is the way that we've thought about criminal justice reform and efforts to make our cities and communities safe. I think a lot of the movement that's been happening in the last few decades has been focusing on police, jails, and law enforcement, but we've not been paying attention to medical examiners and coroners. They're a missing part of the puzzle. And what medical examiners and coroners are supposed to do are examine the bodies of people who are killed by police or under mysterious circumstances and tell us the truth about what happened to these individuals.
Yeah.
And what we're finding is we're not finding that, actually. We're finding something quite different.
So I mean, in some cases, it's high profile. We hear it on the news. We see video. I think that has brought a lot of things to the fore. So we recognize what happened and how it happened. But in some of these cases, we don't know how it happened, and there is no video and there is no news coverage. And so how do you determine whether or not police are at fault in these cases?
Great question. Again, I think that a lot of it has to do with what state you live in.
Okay.
Across the United States, each state has its own laws allowing the public to access death records and autopsy files. So Illinois is a state that allows public access to death records. So does California, but New York does not. And so what that means is that when the medical examiner is doing their work, presumably in our interests, if you live in a state where you don't have access to those records, there's really no way to actually contest the findings unless you hire a private investigator, which many families try to do. But that's really expensive. And we should have a system that everyone should be able to see with sort of their own eyes what exactly these death records say and what's going on.
Sure. Give us an example. What's one of the cases that you looked at in your book and found that the coroner's findings were questionable?
So, when I started this work, I met a woman named Helen Jones, whose son, John Horton III, was killed inside of Men's Central Jail here in downtown Los Angeles. And John's case is a real tragedy in that John was someone who was suffering from a medical health crisis and found himself in jail rather than in a hospital, which often happens. And when he was in jail, he was thrown into solitary confinement. Law enforcement claimed that John killed himself, that he hung himself with his bed sheets. But when his mother and family got the body, what they found was that John had a broken nose. He had lacerations on his face and shoulders. He had a flesh ring below his wrist, which are often happen when someone is handcuffed and struggling. He had injuries to his back and his spleen, his kidneys, his liver. There was all this violence on his body. And the death investigator initially classified his death as a suicide, but his mother resisted. She said, this doesn't make any sense. There's no way my son would have killed himself. And look at all these injuries on his body. And it's because of Helen Jones and her courage and bravery, she pushed against this, and the medical examiner actually changed the classification from suicide to undetermined. And the question she asked, and many others who've been supporting her, the local organizations and myself, how could John have had all this violence on his body when he was in solitary confinement? Mm-hmm. How could he have blood on his shirt and his clothes and a broken nose? And so this raised an investigation for her and for me and the research that I've been doing in my lab here in LA, looking at other similar cases.
Is there any research on how often this happens and how often these findings are really questionable based on the physical evidence that's found?
When I started this work, I thought, surely there must be some agent of government, whether it's at the federal, state, or local level, that you could go to and say, hey, I want to know everyone who was killed by police in 1985 or in 1996. Doesn't exist. Mm-hmm. There is not a single government institution in this country that can tell you the names of everyone who's died in police custody. Mm. What we haven't said is a broken system that Congress has designed to be broken. And that system allows police to voluntarily report the names of people they kill. And the voluntary part is important because in some cases, law enforcement are not disclosing who they're killing in their custody, or they're misclassifying those deaths in ways that make them seem not at fault. What I've been able to do using some data science work is find a rough estimate that between 2000 and 2020, police during arrests have killed 32,000 people during that time period. Now, to put this number into some sort of perspective, we have, since the beginning of this country, going back to 1608, executed 16,000 people going back to 1608. So just in 20 years, law enforcement, just during arrest, have killed more than twice the number of people we've executed in this nation. And so this is a crisis hiding in plain sight.
So one of the things that you're doing in your work is looking at how biases impact the coroner's findings. What biases have you found, and how have they manifested themselves in these cases?
This bias happens in many different ways. One sort of very clear way is that many medical examiners and coroners, they don't run for office. They are appointed by a local board or a local politician, or even in some cases the governor. Why does that matter? It matters because these roles are roles that are not actually accountable to people. They're not accountable to voters or constituents. They're accountable to the people who put them into office. Mm. Those people who put them into office, though, also pay the financial settlements to families when families sue law enforcement or the county for taking their son's lives or their daughter's lives. So think about, there's a conflict of interest. If your boss is appointing you to take care of a community, but also that same boss is paying for the bills and the receipts for whenever people file lawsuits, then you've got a conflict of interest there. But also, in many states, police can be in the room during the autopsy. I'm going to say that again.
Wow.
Law enforcement who take our lives can be in the room while the medical examiner is doing their work. And there you can see, in many of the records we looked at, direct influence where certain injuries are downplayed, certain connections between the actions of police and the death of the person are obscured or made difficult to understand. Thirdly, medical examiners are humans like everybody else. And if they're, in many cases, they're in these roles and they don't have term limits. They can be in these positions for 10, 15, 20 years. Mm. They get to know police. They get to know law enforcement because they're interacting with them pretty regularly. Yeah. And what that does over time is it creates relationships, and those relationships obscure their objective work and really kind of get in the way of telling the truth.
We're talking with Terence Keel. He is a professor of human biology and society at UCLA. He's also the author of the new book, The Coroner's Silence, Death Records and the Hidden Victims of Police Violence. So what did you find when you looked at various coroners? Were there places where there is a pattern of obscuring the truth in these cases on behalf of the coroner? Is the coroner obscuring the truth in certain places?
They are, and where the pattern is the strongest, where the signal is the strongest, are cases where the medical examiner looks at somebody's body. That person has violence on their body. They've been pepper sprayed. They might have been tased. They've been beaten. And the medical examiner says, this person died because of a heart condition, or this person died because of asthma, or this person died because of a mental health condition. The most, telling example of this was the death of George Floyd. What many don't remember is that all of the really kind of activism began when the public saw his death record, and the medical examiner in Hennepin County said, and I quote, "The primary cause of death was cardiopulmonary arrest, complicating law enforcement's duel." What does that mean? It means George Floyd had a bad heart. His bad heart made it hard for cops to arrest him. Because of that, they had to use more force. So essentially, George Floyd's heart and his body was the cause of his death. And we see cases like this all the time for people dying in streets, people dying in jails, where literally the physicians and doctors are blaming our bodies for why we're dying, not the actions of police and law enforcement.
The other thing that I've seen often in my years as a journalist is people leaning very heavily on toxicology reports, which of course are released by the coroner and saying, well, it's because of the drugs in this person's system that they died. How often do you see that?
Quite often. And what we often see is that with the toxicology analysis, in many cases, there are what we call presumptive positive, meaning that there might be some drug in somebody's system, but it's unclear either because of the instruments that they're using or where they source the blood, whether it's from the heart or from other parts of the body. It's unclear how much was in there. And sometimes a presumptive positive is just enough for a medical examiner or coroner to say, well, this plus a history supposedly of drug abuse or substance abuse must be the reason why this person died. And so that's one way this happens. We also find that in many cases, Black folks get certain kinds of drugs screened that people who are not Black don't.
Yeah.
And so often it's things like PCP or marijuana and THC, certainly alcohol, sometimes mood stabilizing drugs. These are often screened for to be able to find evidence of something wrong with this person.
Yeah.
Maybe they had a mental health condition or a substance abuse issue. And many times this is distracting from other details that are more important for why this person died.
What is the role of race in this? What have you found through your research and what does the data indicate in terms of the role of race in these findings?
Well, when I started doing this research, I knew that Black men and Latino men were disproportionately impacted by police. We know this because more Black men and Latino men are in jails and they're in prison. So the system is bearing down on Black and brown folks more. And what I also know and learned by writing this book is that many of the institutions of policing and incarceration were designed to target Black folks who were enslaved and Black folks who were emancipated and eventually racial minorities. Yeah. But what I've learned in doing this work is that those systems of policing and violence have evolved to police all of us. And when I looked at those data of 32,000 people who died over this 20-year period, what I found is that actually white men were the largest group of people who were dying in custody. But I also found it wasn't just white men. Asian populations, Middle Eastern people, middle-aged people, Republicans, conservatives, non-binary folks, mixed race people, every demographic in America can be found in our death ledger. In other words, police violence is targeting all of us. And this is why we need to have a kind of reckoning with how the medical examiner and coroner is covering this violence.
We're talking with Terence Keel. He is a professor of human biology and society at UCLA. And he's the author of The Coroner's Silence, Death Records and the Hidden Victims of Police Violence. I do want to ask you one more question, and it is around percentages and proportions. So white people make up the largest portion of our population. But when you look at the ratios of who's being killed by police, who's more likely to be affected by that?
Black men and Latino men, no question.
Yeah.
But I think the narrative around police violence is that it's just a Black and brown issue. And if we keep that narrative, then we're not going to have the multiracial forms of solidarity or the multi-class forms of solidarity we need to dismantle the system. Because if white people think that they're safe and they're not, then they're not going to be bothered to get into the trenches with us, with organizing and protesting and doing the things we need to change the system. This is truly an American crisis, and we need all hands on deck.
All right, that's Terence Keel. He's a professor of human biology and society at UCLA. His new book is The Coroner's Silence, Death Records, and the Hidden Victims of Police Violence. Support this brother. Get this book. Again, it's called The Coroner's Silence, Death Records, and the Hidden Victims of Police Violence. Terence Keel, I want to thank you so much for joining us this morning on WURD.
You're listening to The Week on Word.
Why is WURD important to the community?
It matters to me because I was only successful truly through Black media. If we're just keeping it all the way 100, like if it wasn't for Black media, you wouldn't know who a Music Soul Child is. Please support your local Black media, all Black media, because this is the media that supports you.
We are giving voice to the community, and without the community, there will be no word. We are one and the same, and it is not a game. WURD.
This is The Week on Word, a podcast highlighting the top conversations on Word Radio. Make sure you look for and follow WURD Radio on social media. Up next, Dr. Kayla Elliott, Director of Workforce Policy at the Joint Center for Political and Economic Studies, joining Evening Words with Dr. James Peterson.
I am very, very excited to welcome to this program Dr. Kayla Elliott, who is Director of Workforce Policy at the Joint Center for Political and Economic Studies, America's Black think tank. Dr. Elliott leads a team of experts who center Black communities in policy debates concerning the future of work, workforce development, and access to good jobs. Here to talk about the U.S. Department of Education and so much more. I'm happy to welcome to this program Dr. Kayla Elliott. Dr. Elliott, welcome to Evening Words.
Thank you, thank you, thank you.
Thank you so much for being here. You know, Dr. Elliott, a lot of times, there's a lot of conversations we've had on this program over the years, and people are like, man, we need a Black think tank. We need to get a Black. So can you, first of all, can you just share with folks kind of like the mission and the origin of the Joint Center for Political and Economic Studies? Because I think there are a lot of people who don't think there is no Black think tank. Folks, we have one, and they're doing great work, and it's the Joint Center for Political and Economic Studies. But Dr. Elliott, talk about the mission of the Joint Center and the work that you do there.
Yeah, so the Joint Center has been around for 55 years this year.
Congratulations on 55 years. That's amazing.
Thank you. Yeah, we have been around for some time, for sure. And I know a lot of folks look to and or are looking for that voice in the space. We are small but mighty, for sure, and really started out just forming a lot of relationships on the Hill and being a resource for Black elected officials, and continue to do that work, for sure. One of our best known reports and some of our best known work is led by our government diversity team, really tracking and encouraging the diversity of both folks who are elected, but also the folks that they hire, right? So how many people in the House of Representatives or in the Senate actually have Black staff, have a Black chief of staff, have Black senior staff, right? And what are those roles that lead you to having a senior role, and how many Black folks are in that pipeline, right? So I know they say that is a spicy day on the Hill whenever that report is released. And huge shout out to Dr. LaShonda Brinson, who's been leading that work for a number of years. We've been doing that for decades. But my team is centered on workforce development. What that means for a Black think tank, my best friend actually the other day just sent me the meme that's like, I could tell you what my best friend wore on the first day of 6th grade. I could not tell you her job. I'm like,
well, your job is not simple. Wait, Dr. Elliott, this is a complicated job, but please break it down for us.
Sure. I think the easiest way that I explain it real quick is that I do research in DC on federal laws impacting higher education and labor. So I do research and think about college and universities and what it means and who has access to it and what works and what doesn't. I had an awesome conversation with my Uber driver the other day. What do you do in DC? I said, well, CDLs? He said, yeah. I said, we're working on a law right now. They just passed a law that people can use.
CDL is a commercial driver license.
Commercial driver's license.
We break down all acronyms here, Dr. Elliott. We break down all acronyms.
Gotta do it, right?
Yeah.
So CDL, CNA is another one, right? A certified nurse's assistant. Accessible jobs that people can get shorter term training for, right? After high school. So post-secondary after high school. People can get accessible jobs that have some good benefits and potentially might lead to advancement, right? To something further down the line. Congress passed a law last year that said you can now use Pell Grants, right? For those types of programs. So you don't
An incredible law, very important, getting some federal tax dollars to support actual workforce development.
Absolutely, right? And so just kind of breaking that down and giving some real examples on what's happening in the field right now. I think people understand policy. People actually do understand policy because policy impacts them in so many ways. So giving people real examples, giving people accessible terms, accessible like careers that give example, like to say like, hey, okay, CDL, CNA, those cosmetology, very real people, that jobs that you know that people have, and saying like, yeah, how did you fund that? Did you come out of pocket? Did you take out a loan? Here's how it's going to look different later, right? They get that part. The part that it's my job to break down is how that happens, and how we do that in a way that is safe, that protects students, that protects borrowers, that protects Black folks, right? So how do I make sure that Black folks are not only being pushed into CNA programs?
That's right.
That they're going into BSN programs as well.
And RN programs, that's right.
Exactly. They're going into nurse practitioner
registered nurse programs, nurse practitioner programs, that's right, yes.
Absolutely. They're going into the fields that lead to a much higher wages and better opportunities for advancement, right? So I want to make sure that my whole thing is Black folks can be wherever they want to be, right? Like wherever you want to be in leadership, wherever you want to be professionally, like making sure that the mission of the Joint Center, which is to eliminate barriers to Black folks' economic freedom and full freedom here in the United States. Like, how do we do that? Because there are so many intentional and unintentional barriers in the law. And a lot of the times part of my job will get folks on the Hill who reach out and say, hey, we are working on a different workforce law, which is the Workforce Innovation and Opportunity Act, right? WIOA. WIOA funds, gives federal funding to public workforce development systems. Each state calls it something different. In my home state of Florida, it's Career Source. You might be familiar with Job Corps. You might be familiar with
Job Corps.
The county, like the county job office, right? Like you might be familiar with those different things, right? How do we make sure that Black folks who are overrepresented, meaning we're about 13% of the American workforce, but we are overrepresented in the public workforce system and in those programs. How do we make sure that it's doing right by those people? How do we make sure that, again, we are going into those training programs that lead to a life-sustaining, family-sustaining, livable wage, right? You can support yourself, you can support your family with this career. Because if you got to think about like, all right, for a Pell Grant, now you can spend, like a Pell Grant is a set amount of money. You can spend your Pell Grant at a traditional 4-year school in a college town. You can spend your Pell Grant at the community college that's 20 minutes away from you. You can spend your Pell Grant at now a workforce training program, right?
Amazing.
Ending in the evenings. You can spend your Pell Grant even on an online program, right? What's the best use of your dollars for your goals? Right? What's the best use of that dollar, that public dollar? And it has a cap. Like, what's the best use of that from a government perspective, right? How do we make sure that the institutions are accountable? But also, what's the best use of that for you as a learner, as a worker, and what you need? And how are you being informed? What's the role of the institution, the college, the program, and letting you know what that is, and so on and so forth. So that's again, it's a algorithm calculus level job. This ain't like simple math 1 + 1 = 2 kind of job. And we appreciate all of the work that you all do at the Joint Center. It's very, very important. Again, not enough people even know that we have a Black think tank that's been working for 5+ decades. But there's so much for us to try to dig into here, Dr. Elliott. So
One, I'm curious as to how your work is being impacted by a couple of different things. One, in recent times, you've seen the relaxation of college degree requirements at certain state and municipal levels, which I think is a good thing for workforce development. So the governor of Pennsylvania said, hey, there's a slate of jobs in government in the state of Pennsylvania that you just don't need a college degree for. Have at it. The city has followed suit there, and I think there has been more energy around non-college degreed workforce development. From the policy perspective, do you see that as a good thing? Is that the direction that folks should be moving in, or does it feed into too much of some of the limitations that you see around workforce development, particularly the over-indexing of Black folks on the lower rung of some of these industries?
Yeah, so they call that STAR, if we breaking down acronyms tonight, and that's skilled through alternative routes, right? So you might have been skilled through experience. You absolutely have been skilled through military experience. You'd be surprised how much you can have like a 20-year career as a medic, and that does not translate to easily being able to become a paramedic as a civilian. And so there are just like very real examples where it's like, clearly this person is qualified for this job, but they simply cannot check that box of having a degree, but they are absolutely skilled through alternative routes. So they are a STAR. In state of Pennsylvania, like you said, and some of the like city level folks have transitioned to that. We've seen a lot of that in the public sector with public jobs, state, city, so on. We've seen some private sector folks do that as well. But research is saying it's not the majority of like middle income, upper income jobs, right? And so you still see that stratification, you still see that division of jobs. It's much more on the entry level, and it's it depends on the field, right? So I think that is like part of the future of workforce, and that's the present, right? Like many states have adopted STAR approaches and found ways to open up public sector jobs. I think that will always be a good thing. A degree is a number of things. One of the things that it is workforce training. It's a number of other things, though, and I never, ever, ever want to have a conversation with Black folks where we don't acknowledge those other things in terms of your social network, in terms of your professional network, in terms of the support systems, but also in terms of the amount of like literacy and critical thinking and like world exposure that goes into college, traditional college, right? And as someone who like most of my career, I've been exclusively higher education policy. Moving to the Joint Center, I do a lot more workforce policy now. But always want to be clear about that distinction is like, it's 4 years and it's a lot of reading and it's a lot of exposure to new ideas. And it develops you in a very different way. And we shouldn't discount that part and think that college is just another.
There's still value to the college degree. Thank you for saying that, Dr. Elliott.
Absolutely. Like economic value for Black folks, especially, right? Like we have to hold things in tension. We have to acknowledge that right now, still to this day, for most Black folks, your path to a family sustaining income is through a traditional college degree. We get that. We have to acknowledge that, but we also have to understand that that is an issue and was not always that way. It was that way for our parents, certainly not that way for their parents. But we have been I've been having a lot of conversations recently about like, we're trying to make education fix it for so many other societal issues.
It can't be that. It cannot be that. It cannot
be that, right? Like they say education is the great equalizer. And that was true and can be true.
That is not true now. It can be true.
Like, it can be true, but it is not universal. It is not true all the time. What we're trying to say is now you need a college degree in order to afford a home, right? That's not a everybody should go to college issue. That's a something is wrong with the mortgage industry issue. Right? Like we have to talk about all of these
same mortgage industry and the banks that are responsible for the greatest bleed off of Black wealth in the history of this country during the mortgage crisis earlier in the 21st century.
There we go. Right? And so it's like, I get it, right? I get that we need better training. We need better, we need more affordable college. Absolutely. But like, we're trying to say that like, do this thing, push yourself And it really is just us forcing the issue back on individual choice instead of looking at the government's role in this and looking at corporations' role in this, for sure.
Dr. Elliott, what would be the language that we would use to kind of expand our conceptualization of education so that it included these workforce pieces?
What do you mean?
So I want folks to think of four-year college degrees as a pathway towards education, middle class, et cetera, et cetera. But I also want them to understand that getting a CDL, getting a cosmetology piece, especially if it's Pell Grant funded, is a form of education, right?
Absolutely. Yeah.
So how do we expand our community's sense of education to be more inclusive of the workforce opportunities in front of us?
Yeah. This is a post-secondary education is technically the term, but that is a branding issue. It's not fun in these days, right? But it literally is post-secondary, anything after high school. I've also been involved. Another thing that we do is think tank, and the think tank sector is get together and think real hard about stuff. And have been involved.
I love this about a Black think tank. Yes,
it's fun for the blurs. It's fun for the blurs. But I think one of the things that some of the conversations I've been in is about like folks who don't want Black folks going to college, folks who don't want Black folks seeing the investment there, folks who don't want programs targeted towards Black people, folks who literally we have a government that is telling us we cannot even disaggregate, big word, separate, right? We can't even separate people's outcomes by race. So if you got 10 people in your program, right? And you say we have a 75% pass rate, we have an 80% pass rate. I say, well, how many people in your program are Black? And you say 3. So how many of the Black people are passing? And you say, I can't tell you that. I need to know before I recommend your program for Black people. I need to know before I, as a Black learner, join your program. I need to know before I continue to give you government dollars if you're discriminating, because government dollars should not go towards that, right? Like I need to know if you have a problem with the fact that none of your Black students are finishing, right? Wow. And like data is so important for us to even know what's going on and what programs are enrolling Black people, what programs are serving Black people, right? And so it's like the folks who are on that end, who are pushing those types of changes, who don't want transparency, who don't want data like to be efficient and accessible, who don't want knowledge at the end of the day to be accessible. Right, about what programs are doing well. And that's all types of programs, college programs, workforce programs. I think they realized that this was a branding issue a long time ago and have had some very real and powerful communications campaigns against the value of college and against the value of any post-secondary training and against affirmative action and against even recognizing race and again, like
in anything,
what's going on, right?
Yeah. So, Dr. Elliott, unfortunately, that message has been too compelling in our community, where a certain sense of anti-intellectualism, this is the challenge for me. I believe in workforce development. I believe it is part of the solution for our community in terms of economic development. But I hope we can continue to do it and advance it without throwing the college degree process under the bus, right? Yeah. Because you can still look at the data of pursuing the college degree within our community and look at the economic outcomes over the life of those careers, and you compare it to other careers, it still is, as you mentioned, a certain distinct kind of pathway for economic success. It's not the only one, but it is one. Dr. Elliott, so I wanted to dive into the Ed department and this new kind of agency partnership piece they're talking about. Hopefully you can talk us through that. But before we dive into that, help us understand from a policy perspective kind of what this administration's goals are with respect to the education department. What have you seen that has been different or distinct or crazy over the last 11 months from this administration and its relationship to the Department of Education?
The goals, this has been a very, very different experience. I've been working in DC in federal policy since 2019. And for sure, this Trump administration is very different than the Biden administration and even the very first Trump administration, given some of the really drastic changes that we are seeing to the administration. So the administration is all of the different departments and all the different secretaries. You've got education, labor, health and human services, state, commerce, a number of departments, right? And the Department of Education in particular has so many important and critical roles and responsibilities for all students, but for Black folks in particular, right? Their Office of Civil Rights is incredibly important to making sure that students, Black students, other students of color, other minoritized students are treated well by their teachers, institutions, school districts, colleges, training programs, et cetera, right?
Our Southeast one here in Pennsylvania has been shuttered under this administration's tenure.
Correct, right? And so that is when I think about the number of conversations that were had about voting not mattering, or about about the last two choices not really having a difference and not being felt. And the reaction when people understood that if your child had an IEP, this means very, very
an individual education plan.
An individual education plan, right? If your child needs any type of special accommodations for their hearing, their learning, their sight, whatever, like that. That was probably one of the first moments that I think people understood the role of the Department of Education and how in some of their students' lives, and how that could really change drastically under this administration. Like, the government does provide quite a few protections and laws. You may not, some of them, if they're working, you shouldn't feel them. You shouldn't, right? You
Government's invisible if it's doing its job right.
Right? Like, you should be able to say, my child needs some support. Or your child's teacher may reach out and say, we think your child needs some support. We're going to have them tested, have their hearing tested, have them tested for a learning disability, whatever it is. And we're going to put a individualized education plan in place for them, right? And that is the government at work, right? The resources necessary for that to happen, the training necessary for people to understand what's going on, the processes necessary to make sure that the resources your child needs are there in K through 12 and in post-secondary, right? I think that was one of the moments where people understood how real it was going to get and how much could change. And that is one.
But so Dr. Ellie, I'm being triggered and traumatized here because I think you're right, but like a lot of people, a lot of us, me and my colleagues here, we were saying this. We were saying this was being said. We were going page for page with Project 2025. We were talking about what, elections have consequences. We were talking about what the consequences would be before the election, but for too many folks, not necessarily in our community, because our community came out, but not in the same way it has come out in the past. But it wasn't compelling. It wasn't compelling enough that there would be these consequences.
So last segment, you and I had a little quick conversation about like a branding issue, right? And a communications issue. And I think that the other arguments are winning. They won, right? Even if they didn't get you to vote against your interests, maybe they got you to stay home. Yep. There you go, right? Yep. Or they got you to participate in some conversation that got somebody else to sit home, right? And I think like a lot of the world is changing rapidly. The pace at which the world is changing rapidly, right? And I don't think that some of our arguments have caught up in terms of a communications perspective, in terms of a branding perspective. Like, who are I love when the folks, one of the folks that I follow right now is Elizabeth Booker on Instagram. She is a trained, I believe, like JD and maybe Master's Public Health, but like also in a very similarly in a DC role, worked for the government, and gets on and literally just breaks things down, right? And has conversations and is much more of a influencer, conversation starter, has a huge following. And I love to see folks who get it because they know it, because they work in the space, break it down on social media, because that's where conversations are happening, right? That's
I just followed her on IG, Booker Squared. I just followed her on IG.
Yeah. Right? Yeah, Booker Squared. And I think there's a number of Black creators and creatives who get it, right? They are trained in poli-sci. They are trained. They worked for the government. They work for campaigns. They're politicos, et cetera, who are awesome voices and can break it down to you in not their opinions, but on the fact of the law, right? And how things work. And I think we just need to be empowering a lot of those voices in the spaces that they're in. I talk to Congress, I talk to other nerds, I talk to other researchers, right? But I'm in conversation with people who are in the public conversation also. I talk to y'all, right? When media reaches out, I'm happy to, right? But I do think that there are so many more of us who can be elevated into those spaces. I think we lean on celebrities. We lean on folks who are voters and absolutely have a space and a place to talk and speak. But I think it's pretty nerdy. The ins and outs are pretty nerdy, and breaking it down in a way for people to get it is a skill. So I would love to see more of the nerds with the skill have bigger microphones for sure.
So thank you for that, Dr. Elliott. That's very helpful in terms of thinking about not just the future of work, but the future possibilities and potential of this very fragile democracy. I want to frame this question by saying, bureaucracy itself is not inherently bad. But there are folks in the political world, regardless of their political affiliation, that want their electorate to think that bureaucracies are bad by definition. But one of the goals of this administration has been to break up what they're referring to as the bureaucracy of the Department of Education. This is a president who said he nominated the former executive from the Worldwide Wrestling Federation to come in and shutter the education department. And what that's starting to look like now is that they're saying they've established this kind of interagency arrangement where they're going to parcel out some of the things that the Department of Education has done traditionally for the last several decades across agencies. Can you bring some clarity to that? Help us understand what that is. Does that seem efficacious from your perspective as a policy person who's worked in higher ed for a long time?
It does not. That is my final answer. It does not seem like it will be effective.
How do you mitigate bureaucracy by creating a bigger bureaucracy is what I need to understand.
Correct. Okay. I don't have that answer because I don't know that there is one. Okay. And I'll give you an example. Next week, we are releasing a report on career and technical education. A lot of folks may know that as VOTEC or vocational education.
CTE,
Yep, CTE program. So a lot of the things we talked about in the last segment, you can do that through the K through 12 and sometimes post-secondary community colleges doing career and technical education, right? You can, if you are familiar with FBLA, Future Farmers of America, a lot of those student groups, those are career and technical student organizations that support students to go into careers, right? We're releasing that report next week, where we talk to Black students, Black directors, Black administrators, association members, et cetera, about their experiences, but also about the law itself. And the law that governs CTE is called Perkins, and what's going well and what's not going well. The law has to be reauthorized, so Congress needs to vote on it again and give it new funding and new structure next year.
What are the odds? What are the odds of that from this Congress?
So what needs to happen in this reauthorization for Perkins? What's going well with Perkins that we should double down on, and what isn't going well, or what else does it need? Right? What it needs is more money, like most things.
Yep.
But that was a little bit of a test case, and we already see some of what is happening with those moves of responsibilities and programs and funding out of the Department of Education into other departments. That move, that interagency agreement happened over the summer, right? They just announced the other moves in the last couple days, but that move already happened months ago, and we've already seen some states, because the money trickles down from the federal funding, gives it to the states gives it to the different school districts, programs, et cetera. States that have had difficulty with small things that should need small solutions, but feel like logging into their resources, like logging into the actual logging into the system, right? And actually like verifying their ID numbers, all these like small things that then have made them wait months for their funding. Wow. So this is states waiting months. So that means, again, the school districts and the programs may wait months also. And so some states have had to, support that with state funding until the funding has come in. And
just to be clear, for the longer wait times for some states who can't fill the gap, that's prohibitive for the programming in the first place.
Absolutely. Absolutely. Right. Like the states are already putting in part of the funding. Right. So imagine what it means that you have to find it elsewhere. Right. And what that does to like the state budget process. And yeah. So I think like we've got some examples of like how this might go wrong. Another thing, like folks have, in addition to the movement of programs away from the Department of Education, there's also just been a lot of staff who've been laid off. Yep. And in the name of cutting down bureaucracy.
Black women over-indexed in those layoffs.
Absolutely. Yes. Absolutely. The thing that I like to point out for people to know is like, these career professionals serve in those roles no matter who is in charge, no matter who is the president.
They don't care who the president is. I'm sorry, but they just they're civil. They don't really care that much who the president is. This is their job. Yes.
Right. My job, let's say my job is to be the person who picks up the phone when someone who runs a state career and technical education office is having an issue logging into their platform. They call me, they email me, I fix it. We have a relationship. They've known me for years in other administrations. They know that I provide good customer service, that I know the answers to the questions, and that I will make sure that their process runs smoothly. That's part of my job. The other part of my job is actually calculating the funding. Right. So there's one pot of funding. There are 50 states. There are territories. We got to break this all down and who gets what. Right. And it's a very limited pot. That money does not go far when you talk about all the students in the U.S. Right. So that's my job. And now I've been laid off. That was my job in the Department of Education for the last 10 years. Wow. Right. I knew how to do that job really well. When you move the program from the Department of Education to the Department of Labor,
they don't know anything. They don't know anything about this work.
Correct. Yes.
This government, this administration is committed to proving that government is ineffective by making government ineffective.
Perhaps.
We're out of time, Dr. Elliott, but a couple of quick questions before we get out of here.
Yeah.
First, Black students made up about 13% of this national secondary enrollment in CTE programs, according to you all's research, which is incredible because it's one of these things that's beneficiary in terms of economic advancement, where our enrollment actually matches or is close to matching our percentage of the population, right? It's working in a certain kind of way. But and again, this is not a political question, just a policy question, if you will. Do you think that it makes a difference who controls Congress post-2026 midterm elections in terms of the reauthorization of the Perkins funding that funds these CTE programs?
I think reauthorization will happen, right? Okay. And reauthorization of Perkins is due. Reauthorization of the Workforce Innovation and Opportunity Act, which is the public workforce law, is also overdue. The Higher Education Act, right? Colleges, universities, et cetera, research in those colleges and universities has not been reauthorized and amended in years, right? I think Obama administration, right? And all of those things could potentially happen, right? Like Congress changes a little more. All of those things could potentially happen. Whether or not they happen is less of a question than what will happen if they are reauthorized, right? And what it could mean. I think the move of all of these programs to different agencies where folks are having to just learn whoever is left in those departments is learning, right? Like such new work, right? And I would assume, given that a lot of the government offices needed additional staff before the cut down, that folks are juggling multiple responsibilities and multiple new responsibilities. I think that all of these moves make all of those reauthorizations of higher ed law, CTE law, workforce law, even more complicated and even more important, for sure.
Dr. Kayla Elliott, please, I want you to know this, and all of your colleagues at the Joint Center, you all, open invitation for you all to come share some of that Black think tank knowledge on Evening Words whenever you all are ready to come through and share. We really appreciate the work that you do there, and we appreciate you taking time out of your busy schedule to come and break down some of these complicated policy pieces for the Evening Words listening audience.
This is the Week on Word.
WURD amplifies Black voices. You make it possible. Whether it's news, community engagement, or conversations that move the culture, WURD delivers because of our listeners. Support what you believe in. Give today and visit wordradio.com/support.
You're listening to the Week on Word podcast. To learn more about our programming, visit wordradio.com. That's WURDradio.com. Our last conversation for this episode features Minority Leader Kendra Brooks, Philadelphia City Councilmember At-Large, who joined ecoWURD magazine with P.O.C.
Starting off with Minority Leader Kendra Brooks, City Council At-Large. Good morning, Councilwoman. Can you hear me loud and clear?
Yes, I can. Good morning. Thank you for having me back.
Yes, thank you for joining us and making time during this holiday season. I appreciate you. You've been doing a lot for the city. How have you been taking care of yourself first and foremost?
I spend time with my grandchildren.
Understood. Please introduce yourself for the people who are just now tuning into the show.
Sure. Hi, I am Kendra Brooks. I'm the Minority Leader for Philadelphia City Council. So happy to be here today.
Yes, and I want to jump right into it. You've been doing some work when it comes down to what's going on in the city as far as what's happening with ICE, what's happening with immigration. And pretty much your work has been championed because you're actually getting some things done to help people when it comes down to immigration. So I wanted to start there. You know, why did you tackle, or why did you feel like this was something you needed to tackle coming out of your office?
It's in our face. It's happening right now. We have folks being disappeared in our communities. And we felt that we needed to do something. So we started to host in-person trainings about what to do during an ICE raid and what you need to do to uphold your own rights and the rights of your neighbors and your coworkers. So far, we have hosted 4 in-person trainings. I partnered with my colleague, Councilmember O'Rourke, State Senator Nikhil Saval, and State Representative Liz Fiedler for 2 trainings that were in South Philly. And I partnered with Philly Queer Fundy, which is a grassroots group of queer organizers, and we hosted 2 trainings in the neighborhood. And the goal of the training is for people to feel prepared and empowered to take actions to keep each other safe. So the trainings have become very popular. We had to begin limiting the attendance to 100 people per training.
And just to think about that, you know what I mean? The fact that you have to limit the resource for people to get the training, right? And the fact that there's that many people who want to understand, you know, how to be safe, what rights they have, you know, what can they do to help their family? You know, that right there is scary within itself, right? And thinking about just the large immigration population that we have, because Philadelphia was once known as a sanctuary city, you know, like, how do we make sure that the trainings that we're putting out is something that can actually help them? You know what I mean? Like, does it really like help them in a way in which they're advocating for themselves, or do they still call your office like, yo, they coming down, like nobody's listening to me?
I think it's both. And I think that people need to know what to do to be prepared and empowered to do something if it happens. But on the flip side, you know, if that does not work, our offices are still very much available for folks to reach out and say, we need support. And that's what this is about. And how can we build a network of folks that are ready to step in and support. And that's why we did it. Our next training will be in West Philly, actually, on January 13th. So if people are interested, they should go to my Instagram at Kendra PHL Council for more information on how to sign up. And the trainings fill up quickly. So I hope folks can, get in this training. So, we have to do something. And this is what our something end up being. What's the best practices is making sure that we can protect each other. And that's why these trainings are so important it was so important for us to put together.
Yeah. And then just by you being there, boots on the ground, doing the work, like what is the one thing that you have, come up against, or one thing that you have found as far as protection for these families to be able to protect themselves? Like, what's that one thing that sticks out to you? Like, make sure you say this, or make sure you have this, in your pocket just in case they pull you over. Like, what's that one thing that people can just do to protect themselves?
I mean, that's the number one thing. Make sure you have all your paperwork in order.
Okay.
Whatever you have it in order, and make sure you have a support system. That's why this is important. Make sure your neighbors or a family member is prepared to come out and support if ICE is at your door or at your workplace.
And just in your opinion, based on the work that you're doing right now for the people who are still in the city, do you feel like Philadelphia is still a sanctuary city? Is this still a safe place that immigrants can come to and try to seek, asylum, or try to seek, their papers to be able to be American citizens?
Yes. We're safer than other places.
Yeah.
And I think that this is why this work is so important. How can we continue to maintain our sanctuary city status to make sure we're protecting our folks that are here and folks that are still coming?
Mm-hmm. And deportation cases also are very expensive, right? In most cases, some of them need lawyers. When it comes down to the trainings, are they able to speak to anyone who knows the law that can actually tell them a little bit more about how they can get in contact with the lawyer if something like this does happen to their family?
Yes, we can actually put people in contact with the immigration rights groups that are in the city that are offering those levels of support.
Beautiful, beautiful. Because that's needed. You know what I mean? Some people just don't know where to start or have these type of conversations. And having a lawyer, or having someone who knows the law is extremely important, especially today, right? Our president ain't never see a jail cell, but, we want to make sure that other people don't see one either, especially if they know their rights, for sure. And my last question, because I want to switch over to the abortion, because we got about 7 minutes left, and I appreciate the work that you did behind that, especially as a woman. But I wanted to just ask you this last question when it comes down to immigration, right? When it comes down to immigration, a lot of people are scared. Like, the fear is there, right? So I just wanted to ask you this space of trusting when they go to these trainings, signing up for the trainings. Like, how can we ensure people like you are safe? Like, this is a safe space that City Council is creating for you to learn, for you to get the information and the resources that you need. You can come out. You don't have to be scared. There ain't going to be no ICE car around the corner waiting for you to leave the meeting and stuff like that. Like, you can come out and be safe and get these resources. Because I'm learning that a lot of people who are dealing with these immigration policies are afraid. Like, they don't want to go nowhere near, open doors that are actually helping them, because they feel like as soon as they leave out, they're going to get caught up.
No, I understand. This is why we're just kind of talking about these that we've been having. The first few were mainly dedicated for folks who are impacted. Okay. Now we're opening it up a little broader. I do think if someone, reach out to the organizers, go to our Instagram, sign up to attend, talk to our organizers, and they will make sure to make, that you're safe coming into this space. That's one thing. And then number two, legislation is important. I do believe that there's a lot more that we can be doing in the city. Mm-hmm. Every issue that the Trump administration has threatened us with, I have not seen our current administration fight back. And I feel like our city is much grittier than that. Yeah. Like, whether it's DEI, the ICE raids, reproductive health care, or sending federal troops into cities. Philadelphia's, our people want us to stand up and fight up against the White House. And I've been working on some legislation that would protect Philadelphia's immigrant population. Mm-hmm. And it includes making sure that ICE agents cannot wear masks or have unidentified vehicles. Make sure that we're protecting our public spaces, and to reaffirm our commitment to our communities. That's what we're doing. So I plan to introduce some legislation in the next coming weeks. But in the meantime, make sure that you go to our page If you want to know what you can do, get involved with some of the trainings. And if you have any questions, feel free to reach out to our office and we'll connect you to the right places.
I'm so grateful that you brought up public safety because that's truly what it is a public safety issue. And I thank you for the work that you're doing. And again, for those who are just tuning in, you're listening to Minority Leader Kendra Brooks, City Council at Large. And we're talking about immigration, immigration rights, the ICE activity that's happening here in the city of Philadelphia. But I also want to talk about the abortion rights that are human rights that you're fighting for at the same time here in the city. And when it comes down to something that you just mentioned, I don't want to let it go past because you actually brought it up when it comes down to DEI. And right now, the city's in an uproar over the new decision over the DEI efforts coming out of the Parker administration. So I wanted to ask you that question, as being a Black woman, what can we do to make sure that local businesses, minority businesses, Black-owned businesses, women business will still be protected under this, new initiative coming from the Parker administration when it comes down to DEI?
I think we have to just continue to move forward. We've been here before. Mm-hmm. We know the consequences, but we also know that we're far more resilient than the Trump administration and the cuts that and the things that they're putting upon our city to do. I think that we have to just stay connected, continue to organize, and it will get through this period in time.
Mm-hmm. And you're doing a lot of fighting right now. And I thank you so much for standing up for us, for sure, Councilwoman, because you are spearheading this resolution declaring, abortion rights as human rights. And this is something that has been a long fight. Like you just said, this is not nothing new. We've been fighting for this for a long time. So, in 2025, why do you still want to stay in this fight and spearhead this fight, making sure that women have rights? Women have rights.
Well, number one, I'm a woman.
Yes.
And number two, I'm a girl mom. Okay. I have 4 daughters, 3 biological granddaughters, plus 2. Like I have a huge, we're a women empowered family here. Mm-hmm. And if being an elected official and being empowered to do this work, if I'm not fighting for the rights of my babies, who else is going to do it for us? And that's why, I launched that Philadelphia Reproduction Task Force last year because we knew that a Trump presidency would mean major attacks on public health care. Yeah. And since then, we're seeing the funding cuts, specifically with reproductive health.
Yes.
So when I say massive cuts, I'm referring to both federal cuts and local cuts. The federal cuts to Title X and Medicare will have devastating effects on women and access to maternal health, Pap smears, STD testing, and preventive care. But the local cuts were an unexpected blow to our providers and patients and the advocates who made up of our reproductive freedom task force. And we know that it will limit patient access.
Yeah.
So every
and accessibility.
Year, like they're seeing it and feeling it now in real time already. Mm-hmm. So ever since the Roe versus Wade was overturned, Philadelphia has provided at least $500,000 in direct funding to reproductive health organizations. And this was a central issue during my last campaign. But in our FY 2026 budget, our city provided 0 funding.
Wow.
And I'm hearing from providers and advocates on the task force that the situation is not sustainable. And without additional funding, women in Philadelphia will be losing access to reproductive care that they need. Mm-hmm. That is problematic.
Yeah. And I actually have your colleague, Nina Ahmad, coming on next right after you to talk about the menopause bill that just took place or just went past yesterday in City Council as well. So we're going to talk a little bit about that. So when it comes down to women reproductive issues or women reproductive rights, this is a huge topic. And I wanted to ask you specifically, you kind of broke it down, but I wanted to just ask a direct question. When it comes down to Black and brown women in the city of Philadelphia who are already receiving assistance for Medicaid and Medicare and stuff like that, how does something like this affect them even more, right? Because we're on, a space right now where the federal government is literally shrinking medical insurance by the day. And then at the same time, we don't even have the resources in the city. So how do you think that's going to affect people, who are already receiving assistance for medical?
You have to keep the fact that to get an appointment for your OBGYN could be a month long. You can go to some of our community agencies, whether it's Women's Health Center or whatever, and get immediate appointments within 24 to 72 hours. Mm-hmm. So we're saying that women will not have access to maternal health care. Pap smears, which are life-changing, STI testing, and preventative care. Like, we're the center of this country. If we can't provide, if we are not able to get our needed care for basic needs, basic healthcare needs that women have, it's hard, especially for women that are low income.
Yeah. And that's why I asked that question, because I feel like there are people who are already in dire need of assistance. They're fighting to keep their assistance. And then when it comes down to just the resources to help them when the medical assistance is not there, that is no longer there either. So I was just trying to figure out, like, what can we do to still keep people going as far as just the disconnect between, local government and also medical, So
and I think they want to make this conversation just about abortion. This is more than abortion.
For sure. Yes.
This is about healthcare. Like, a pap smear is a huge thing. Like, if you can't,
a mammogram is a huge
thing. So many things. And just keep in mind, we're talking about women, but some of these centers also see men. For various screenings. So I think that we need to make sure that
prostate cancer is a big thing.
Yeah. And I think they're leaving the whole idea of reproductive health and want to narrow it down to just abortion. And we're talking about healthcare and freedom and locking poor or low income women into this situation, makes life even more harder.
Yeah. Because I think also when you have a room full of men having this conversation and no women in the room having a conversation, of course you're going to just narrow it down to abortion. You don't even think about what it means and all the body parts that we have as women to even be able to procreate, even be able to get to the baby. We have to make sure those parts are working right. You know what I mean? And if the parts are not working right while we're having the baby or while we are actually pregnant, what does that mean for our actual life at the same time? And I think that people miss that step a lot. But our time has run out again. Councilwoman, I appreciate you for joining us on this Friday. Thank you so much for the work that you're doing. Again, you're doing a lot of fighting. So I hope you are taking care of yourself at the same time. But I do want to just ask this last question, right? Because I feel like a lot of Philadelphians right now feel some type of disconnect towards our city and our administration right now, our city council. So I just wanted to ask you your last words. Like, how can we tap into these unsure voters, these unsure, city residents, to make sure that we still have their back, to know that we still have their back?
I think people just stay connected is like making sure that that your issues are being discussed. Reproductive health care, that's an issue for all women. Protecting community and public safety is an issue for all Philadelphians. And I think folks just need to stay connected, even if it's just on the issues that are near and dear to you. Housing, schools, there's so many different things. Folks just need to tap in and stay connected. And please feel free to follow us on social media or stay connected to our office. We are here to help. I am here to serve.
Thank you so much. Please let them know how they can find your social media, website, all that good stuff.
Our Instagram is at Kendra PHL Council. And our phone number in our office is 215-686-0164.
Thank you so much. I appreciate you. I hope you have a great weekend and enjoy your family next week on Turkey Day.
Thank you.
You're checking out the Week on Word. Represent your favorite station in style. Look for Afrocentric tees, hoodies, tumblers, notebooks, mugs, and more. Just click the shop tab at wordradio.com. Show the world that you're all about Black Talk Media.
You gotta look good.
Thank you so much for listening to this episode of The Week on Word. Let's stay connected. Sign up for our newsletter and listen to us online at wordradio.com and on the Word Radio app.